one of the things that I always do when I look at legislation that is coming before us is to ask the question, does this preserve access to health care? And does this reduce the cost of health care? And I think of that not only in terms of my district, but with all Americans, because having that access, having affordability is key. And whether we're working on health information technologies, which is legislation we are working on right this very minute, and it's something that we've been working on in the past, continuing to look at ways that we use telemedicine concepts. So those individuals who live a long distance from major medical centers can still access top quality health care, but they're able to do it right there in their home communities. Those are provisions that are very important. The health information technologies as a whole, think about the lesson we got with Katrina. And when Katrina hit, individuals were fleeing their homes. They didn't have their medical records. Many times they didn't even have their pharmaceuticals, and they were trying to go to hospitals and seek treatment, and doctors' offices were blown away or washed away. Hospitals where their records rooms were completely destroyed. The individuals who were able to access that care were veterans because we had an electronic system in place. So that's a great lesson to us, and one of the reasons we need to make certain that all Americans have the ability to receive care in a timely manner, and health information technology is a big part of that. Plus, it'll end up saving a lot of money. There is also legislation I continue to work on that looks at the services that are provided by Medicare and also by Medicaid, and looking to make certain that we fulfill our obligation to this nation's seniors through our Medicare program, and making certain that the services that they have expected are there available to them, and that they're easily and readily accessible. That means that we have to make certain that providers are still going to open their patient rolls for our Medicare recipients, and that our hospitals are going to make certain that there are spaces for Medicare recipients. This means that we need to be certain that the federal government and CMS are fulfilling their obligation and to those providers, and we need to make certain that program is working as it is intended to work. It's so interesting that some of those who want everybody to have health care will say, well, let's have this mandate, let's have that mandate, let's have this greater regulation, let's impose this tax. And what we know, the more you tax something, the more you regulate it, the less you get of it. And that's one of those lessons that applies to literally everything. It definitely applies to healthcare. The more you regulate it, the more you try to impose federal restrictions and mandates, what you see happening is cost shifting. So therefore, private health insurance is going to cost more. What we should be mindful in doing is making certain that our focus is on consumer-driven healthcare, where we are preserving options, where we have more options, not only for our seniors, but for those that are in Medicaid programs, that we have options for all healthcare consumers. And our health savings accounts have been a great way that this has worked. That's a piece of legislation that I worked long and hard on and was very supportive of through the entire process. And I was so pleased that the Medicare Modernization Act included health savings accounts, because so many families have access to health care now through that health savings account. Consumer-driven health care that is focused on providing access. That is where our focus should be, rather than having it on mandates. I think that as we go through the election cycle, what we're going to see from Senator McCain are consumer-driven ideas. And there are many people in this country that say individuals need to own those health care policies. Individuals need to own their health care records. Individuals need to have the right to make those decisions of how they're going to access health care. And as we go through the presidential debate, as we go through the congressional debates, my hope is you're going to hear more proposals that put the focus on keeping health care access free and open, and doing that with consumer-driven initiatives. My hope is we're going to see us moving to a patient-centered system. When I ask my constituents, do they want the ability to control their health care records, their health care access, their health care cost, or do they want it handled by the government that brings them the IRS and FEMA? I can tell you what they say. They want to make certain that they're the one in charge of that. And on a more serious bend to that question, we have to be very mindful. Who governs matters. Who makes policy really matters. And there are many here in Congress who would like to see healthcare nationalized, like to see the entire healthcare sector, which is 8% of our economy, nationalized. There are those who are members of this body that would like to take the Medicare template and put that forward for everybody in the country and do away with consumer-driven, patient-centered healthcare. I'm going to continue to fight that because I think consumer-driven, patient-centered healthcare is the way to go, not government